Hi everyone, my name is Valerie, and this is my presentation on meningococcal disease. So it is caused by Neisseria meningitidis, and that is a gram-negative bacteria, and it's a pathogen specific to humans. 1 in 10 people are carriers of the bacteria, which is located in the nose or the throat, and it could be severe or deadly. There are 6 serogroups of Neisseria meningitidis, and those groups are A, B, C, W, X, and Y. So some people, the bacteria will be able to cross the blood-brain barrier, causing meningitis, and in others, it'll happen so quickly that there's no time for meningitis to develop. So here's a graphic showing the difference between meningitis and meningococema. And these are both 2 common outcomes of meningococcal disease, and they're both very serious. So meningitis affects the spinal cord and like a brain infection, and meningococema is a blood infection. So transmission. So transmission could be through coughing, chewing, kissing, or any type of respiratory secretions. It usually happens when a carrier has some type of direct contact with someone else. The transmission rates are highest in adolescents and young adults who serve as reservoirs for and meningitis. Carrier rates rise dramatically during epidemics. And so you'll often see it being most transmitted in community settings, and infants and elders are also susceptible. So here's another graphic which shows the symptoms. So in babies, you'll see often high fevers. They're sleepy, they're crying a lot, they have a stiff neck, they dislike bright lights, they vomit and refuse to eat. In adults, you'll see a fever, headaches, confusion, joint pain, stiff neck, also dislike to bright lights, vomiting. Kind of similar, but it's more difficult to diagnose in a infant. And also it's very similar to other diseases, so it is often hard to diagnose. Okay, yeah, as I said, it's difficult to diagnose, so you should see a doctor. So one way it's diagnosed is by taking, so if a doctor thinks that you could have this disease, you can take a sample of the blood or the cerebrospinal fluid, and you can do lab tests and culture bacteria. You could do a rapid diagnostic test or PCR. So there's treatments. The main treatment, I would say, is antibiotics, penicillin or cephalosporin. The other treatments would be very specific to like the different syndromes. So for example, in severe cases, it could cause you would need an amputation. So that would be a treatment for this. So because one of the main treatments is antibiotics, it is prone to resistance. It's a little uncommon, but it's been on the rise. So how to prevent meningococcal disease? So it has a high, well, not a high, but it has a mortality rate of 10 to 15%, with permanent complications. So there is a vaccination for this, and you often get it as an infant and then again at around 11 or 12 years old. So the vaccinations, there are 3 types. There's the polysaccharide, the conjugate, and then last is Men A and Men B, which those are specific for an outbreak. So key takeaways. So there are 3 takeaways, and which has to do with transmission, treatment, and prevention. So meningococcal disease poses as a notable risk, and it could be carried and it can affect many individuals. It's often seen in adolescents and in young adults, which serve as reservoirs. And it's important to understand these dynamics for treatment. It's also important to understand and take away that antibiotic treatments remain a little bit of a challenge because there is a rise in resistance. And for prevention, it's also important to understand that vaccinations play an important role in being able to prevent meningococcal disease. And it's important to just understand the current research and the public health initiatives of vaccinations. And here are my references. Yeah, thank you.